we'll be able to do that, and bring the information back by 10 o'clock tomorrow morning.
9. I can do it 9:30 because we have another committee. We have other people coming in at 10.
Fine.
We had scheduled you for this afternoon.
Okay,
but
fine.
Even for your officers, because I know they are there.
Okay.
Director.
We will
of
do
clearing.
that. We'll do that by 9:30 tomorrow morning.
9:30.
Chair, before you close.
Yes, Professor.
Could I have a word, please? Thank you very much, Chair. My name is Mahmoud Sheikh, Member for Parliament, Professor Mahmoud Sheikh, Member of Parliament for Wajir South, and a member of the Health Committee. Apologies that I was in another meeting. Now, my point is not about the CAS or anybody, or not about the director's position or anything else. It is about why the CS is not here. If this has been discussed, then I will need to get updated on. But why is the CAS here? If we can remember, the Health Committee has clearly put forward, and it has gone to the House and the Speaker. Yes.
Let me just inform you that we had already dispensed that matter. There's a letter already with us. And so it's only that you came in a little bit late. We had already handled the matter.
Tomorrow he must be here. It's another day. He must be here because the last time we discussed, even in this House, by the Speaker, and the ruling that was given, we want to see the CS coming here. CS Macharia must be here. We are not going to condone issues of, and avoiding this important parliamentary committee that is equivalent under Article 125 of the Constitution of Kenya, puts this House as equivalent to a High Court. And it's not a joke. It's not a joke. Thank you, Chair.
Professor, I would also wish that Honorable Koros,
Order, Chair.
You cannot order the chair. That's one thing. So
point of order, Chair.
You cannot order the chair, Honorable Koros. But I think, members, for us to proceed, because we also have the ministry to give us their direction.
Madam Chair, just one important issue that I want to pass across, and it should go on
Who is
record.
speaking now?
Madam Chair.
Yeah, please, let's speak through the chair so that we can have some order.
Madam Chair, let me put it very clear that, this issue of COVID-19, it's a very serious matter. That as a committee, we don't want to discuss this thing back and forth. I want to appeal to the government and to the executive that they fine-tune on their communication. This is the problem that we have. It could be not, perhaps maybe there is nothing that is going on about this issue of COVID. But when we have people from the executive coming with half-baked information, this is what creates tension and dotted line outside there. So I will appeal that any institution of government invited here, if they know that they are not prepared enough, they need to go back and prepare. So then we avoid all these gray areas. And I will appeal, and I'm sure I'm communicating to some people in the government. So then we have enough information. Public should be fed with enough information. Madam Chair, thank you.
Thank you very much. CS and your team, we've made a decision. Clearly, we need a better document. We'll give you time. You take leave. The information, the direction that the director was taking, that's what we need. If yes, you received, for example, this number of kids, how many were they? We just need full details. Who received, then at what point were they handed over, and to who? So that from there we'll pick it up so that we can connect the dots. So otherwise, when we have these gaps, people will keep on speculating. So thank you. We request you to leave now.
Chair,
and we'll see you at 9:30.
The CS must be here tomorrow, Chair. I want this ruling to be done on. The CS Macharia must be here. We're not going to accept CAS to come and stand up for him all the time that he's avoiding this committee. It is unacceptable. Do we want to call it impunity of the last order? We will not accept it. We will not accept into that. And I want every member of this committee to be able, Senate as well as the National Assembly, to take that with me and second everybody here. We want to see the CS. Why is he not here? We are not going to accept tomorrow that we will not be attending this meeting tomorrow until he is here. We will not accept it.
I'll rule you out of order, Professor. Because once we have documents communicated to this House, we also a House of procedure. We cannot anticipate what will happen tomorrow.
But Chair,
So
Chair.
order, members.
Chair.
We are allowing
Point of order,
the ministry team to leave so that we can proceed. So Ministry of Transport, kindly take leave.
Madam Chair, for
We'll
record,
communicate to the Speaker on this matter.
for record, Madam Chair,
Yes.
I did inform the House, report to the House earlier, that the CS has a commitment and he always attends parliamentary committee meetings wherever he is required. But I said on this occasion, he is indisposed. And I'm saying, you have asked us to come back tomorrow. We will stress to the CS on the need for himself to come personally, if he is well enough.
Point of order, Madam CAS, Madam Chair, allow me. Is it now, if I'm sure you have a role to play. That's why you are a CAS and you are appointed. Whoever appointed you, His Excellency, must have seen your capacity. For you to come to the committee and pass back the issue to the CAS that he can be invited, it means you want to cast aspersion on your own commitment or that capacity to dispense government policy in Parliament. Do you want to challenge your capacity? I thought you are here on your own capacity. You've been sent by your boss to come and the reason why you are his assistant, it means you have that capacity.
Madam
And
Chair,
Chris, I know you have the experience. You should not panic.
Madam Chair,
Now, I don't know why we are having this argument.
I
I've ordered
I'm
ministry.
equally
I think you need more time to go prepare
Chair,
yourself,
Madam
give
Chair,
us facts.
Madam Chair,
Madam Chair,
And so,
permit me to weigh in on this, please. Kindly, Madam Chair.
Honorable
You know,
Kagwe,
we are not arguing. What I hear the members say, and I'm certain you've heard them, and the CS has heard. What he has said is very simple. He's going to place on the CS to attend tomorrow if he's in a position.
yes,
It's as simple as that.
yes.
But we need to place it in home that if the CS is unwell, we pray for his quick recovery so that he comes and faces this team tomorrow.
But honorable
But if he's
members,
not well,
I
we
also
shall
want to
excuse that.
remind you,
Thank you.
Honorable Jagagwa, that the last sitting, it's always good to be fair. The last sitting we had, the CS Transport came and appeared. And I don't think we have ever invited him and he has ever failed to come. There is a proper document forwarded to the clerk's office. So if there is a reason, all of us, anybody can be sick, anybody can have a commitment. So I don't think we need to really belabor on that point. We have directed the ministry. The most important point here, your document is not adequate. Go and prepare. Let's meet tomorrow at 9:30. Thank you. Let's go to the Ministry of Health.
Thank you very much indeed, Madam Chair. Madam Chair, could I just start by saying that indeed I am aware that my colleague is ill-disposed and would have loved to be here himself because I personally spoke to him on my way here, wanting to know whether he is coming, and I'm aware that he is ill-disposed. So I think it's good also to clarify that and to clear that it is not, he did not leave, he did not come here intentionally. And I would like to clarify that. He wanted to rest the case with my friend, Sheikh.
Thank you, CS. Thank you.
Madam Chair, let me start from the outset by saying that I am here to clarify a number of things that have been raised both by Parliament, and by Parliament I mean both houses, and issues that have also arisen in the public mind as a result of the communication that has been going on in regards to COVID-19 in general and specific issues that have been raised that involve matters of transparency, matters of management, and matters of accountability. From the outset, Madam Chair, let me say that when it comes to matters of accountability and matters of transparency, my ministry is determined that this is going to be the case. We are determined to clear every single item and every single issue that may be in doubt as far as this committee is concerned, this House is concerned, and the Kenyan people. because it is only fair and right that they do so. We have no intentions of protecting anybody. We have no intentions of hiding anything. And, Madam Chair, I will do my best to clarify any issue at all that may have a reason between the time I was here and give specific details and the time and this time round. And just to say, Madam Chair, that it is important for this to happen. You have rightly said yourself that what happens is that when there are gaps, then you'll find that people will make up, or creativity will intervene. And that creativity, while important and good, is also important to clear, because it plays around with people's reputations, it plays around with people's names, and so on, and people's careers. And especially at this time, when this disease is still ravaging us, it is still continuing, day in, day out. COVID-19 as a virus is not finished. It is not a past tense. It's a present tense. Today, we will be announcing some people who have got the disease, and tomorrow we will be announcing others. God help us that tomorrow we will have no deaths and so on. But I think it is good to bring it to light that as we discuss these matters, let us not discuss COVID-19 as if it is over. It is here and present, and will continue in the foreseeable future. And we pray to God that the people, that we do not lose any persons to this disease, as is currently happening both in Kenya and elsewhere in the world. So for me, Madam Chair, there are a number of issues that you have alluded to and have been asked to respond to. And what I propose is I will respond to the general questions. We have got the details of every single item that I'm going to mention. Every single thing I'm going to say has got an annex, a very detailed annex of what is included in it, and I'll be happy to respond to each one of those issues. Madam Chair, the first item I'm supposed to respond to by way of answer is the role played by the Ministry of Health in clearing Jack Ma's Foundation COVID-19 supplies donation and other donations. Madam Chair, let me just say this, that following what you have just heard, the clearance of any government donations is in the hands of the Ministry of Transport, as has been indicated. And indeed, we confirm that as the ministry itself has indicated, it is true that that's what we got. The general procedure of receiving donations in the ministry is through communication received from donors directly or through the Ministry of Foreign Affairs, informing the intention of donating commodities, equipment or services, and their quantities, when to be received, and the point of entry or delivery. The ministry then gets in touch with the government clearing agency, which is responsible for the clearance of government cargo, to confirm arrival and requirements for clearance. Once the commodities are cleared, they are transported to KEMSA or to KEMRI for storage and subsequent distribution. In regard to Jack Ma donations, the Ministry of Health received communication from the Ministry of Foreign Affairs for 3 consignments. Those 3 consignments are in Annex 1 of this document. The second Jack Ma Foundation donation came in 2 consignments. The first consignment was received from the government clearing agency on the 15th of April and cleared and delivered to KEMSA on the same day. Annex 3 of the document here spells exactly how that happened. And as Kas Obure had indicated, that is precisely what happened. The second consignment was received from the government clearing agency on the 28th of May 2020 and delivered to KEMSA on the same day. The details of the consignment are in Annex 4. The third Jack Ma Foundation donation was received on the 24th of May 2020 and delivered to KEMSA on the same day. That is Annex 5. In regards to local donations, The Ministry of Health was notified by donors on the intent, and continues, by the way, to be notified by donors who intend to support the fight against COVID-19, indicating what type of donations, quantities of donations, and sometimes the donors specifically indicate who they want to give their donations to, or what type of donations they believe are more useful than other times. And since this is a donation, we sometimes confer with them and agree. If a donor wants to donate to a specific county, we have no issues with it. We receive and take as they donate. Madam Chair, on the role of the Cabinet Secretary on KEMSA management and procurement of COVID-19 health products and technologies, Madam Chair, let me just respond as follows, and if you allow me, explain a little bit more. To say that the role of a Cabinet Secretary, not just Mochache Kagwe, the role of a Cabinet Secretary is to provide policy and strategic guidance and leadership, in this specific case to KEMSA, but widely in the institutions under each ministry. Madam Chair, this is an important question that you raised, because it refers largely to some of the things that I have personally been verified for regarding my intervention or so-called interference with...
Chair, point of order, Chair.
What is out of order?
I request Wasiri not to clean himself here, because when us we have information, let him go direct to...
Honorable Koros,
Please,
you can also not gag him, allow him to speak, then you can make your judgment. I think we have called him here to express himself. Once he does so, it is for the committee to come up with a conclusion. So let's allow him to proceed. Proceed, CS.
Thank you, Madam Chair, for the protection. Madam Chair, may I be very clear that the role of a Cabinet Secretary in any institution is essentially to give guidance, is essential to provide leadership, and Madam Chair, all Cabinet Secretaries must at all times be in touch with the institutions which they run. Otherwise, what would they be doing? Madam Chair, in this instance regarding KEMSA, and in direct response to the question that you have asked, of course, Madam Chair, I have engaged KEMSA repeatedly especially over that COVID-19 period. And Madam Chair, it is my job to do so. It is my job to talk to the ministries. Madam Chair, as we speak right now, the KEMRI boss is here with me. We consult. Last time I was here, we were with the chair of Kenyatta National Hospital. We consult. There is not a single CEO that I don't consult with continuously. Because, Madam Chair, it is my job to communicate policy, it is my job to communicate government strategy to the respective institutions that I have in my ministry. Madam Chair, in this specific case, for example, we were in a crisis. And Madam Chair, yes, we do not micromanage the institutions which we run. But we were in a crisis. And I can repeat, and I can give you examples of meetings that I had with the chair, with the CEO of that institution. I called in the people from KEMRI, and the boss is here. I called in even lab technologists and technicians to discuss in a crisis where we knew nothing about. Which are the reagents that we need? Where do we get them from? What are the other items that we are going to need to fight COVID-19? And Madam Chair, it is easy to forget how the situation was at that time in March, when the whole world was dying away. In some instances, we are being told 1,000 people are dying per day. We are not ready. Everybody in the country is screaming for PPEs. It would be totally irresponsible for me to sit in my office and not ask my executives and not try to bring everybody together from KEMSA, the laboratories in KEMRI, the laboratory in National Influenza Labs. I was bringing all these people together in sittings so that we can be able to get a solution to a problem we knew nothing about, to a challenge we were not ready for. So, Madam Chair, I also communicated directly to the CEO and gave government policy. For example, I am the one who gave direct policy that going forth, because of the high cost of PPEs globally at that time, we were able and zeroed in on local production of the same materials, which cut the cost, Madam Chair, from 9,000 shillings, which was the global prices at that time, to 4,300 shillings, a cut down of over 50%. Now, Madam Chair, it's my job to communicate to the CEO and to say to him, government has made a policy decision that going forward, we are not importing PPEs, we are going to buy them from local approved suppliers. And Madam Chair, that is my job. That's what I should do. So I am at a loss. I was at a bit of a loss when I'm told that I am giving directives or I'm trying to influence, I'm putting pressure. Madam Chair, I put pressure on each and every person in my ministry at that time. And in fact, Madam Chair, what I should do is apologize and thank them for the pressure in which they were working under. And I think it is important, Madam Chair, also to remember, there is an old saying in English, when the war gets very hot, even the generals go to the war front. And for me to sit in my office and do nothing would be totally irresponsible. And therefore, and I answer this question, not just in regards to KEMSA, but also in regards to other institutions, and indeed, in regards to government management. That's what we do. That's what my job is. And that's what I must continue to do if we are going to be successful in this fight. Madam Chair, if I may give another example. I have spoken. I mean, the CEO of Kemri is here. We have been with him around the country. We were with him in Kilifi to try and detail and talk to people there about the possibilities of working for a vaccine, for this, for against this disease. And I have been with Kombe to Kilifi for the same. That's my job, Madam Chair. It is my job to put people under pressure so that they can produce the results we are looking for. It is, however, not my job to tell anybody to commit any crime. It is not my job to advise anybody against anything that they are not supposed to do. And in the event that I told a CEO to do something that is against the law or something they were uncomfortable with, the normal thing to do in government is to say, give me what you are telling me in writing.
Point of order.
It is out of order. That's Honorable Tongoyo.
Yeah, thank you, Madam Chair.
And take the opportunity to introduce yourself, and I can see you have a friend next to you whom I request to move to the next seat so that we keep social distance.
Okay,
and
thank you, Madam Chair.
If you are seated somewhere that is not written seat here, no, you are seated in the wrong place, then take another seat. Thank you. Proceed, Honorable Tongoyo.
Thank you, Madam Chair. Gabriel Tongoyo, MP, Narok West, and a member of this committee. Madam Chair, from the list of questions that I asked to the CS to respond to, there are quite a number. And I think it should be fair enough for him to respond to question 1, 2, and down, so that we probably come to the questions. He seems already to have jumped the gun, answering to what we even actually have not asked.
Thank you. I think CS be guided that you also summarize.
I am summarizing, Madam Chair, but the question is really quite clear. The role of the Cabinet Secretary on KEMSA's management and procurement of COVID-19 health products and technologies. Madam, that's what I'm trying to expound on.
Yeah, but you're already asking, actually answering like accusation. I'm sure you are referring to a question, or something that was raised in Senate, that you instructed, you kind of forced the procurement processes. So we have not reached that, maybe. I don't know.
Madam Chair, if I may summarize on the answer to the question, I think the other role that we played and we continue to play on COVID-19 is this. Madam Chair, as we speak right now, we have a crisis. We have a crisis because we do not have reagents. The American government has blocked or has suspended the exportation of reagents for testing our people. Madam, it's my job right now to liaise with KEMSA, and I indeed spoke to them yesterday. What could we do? What is it we can be? How can we salvage the situation that we have got right now in terms of shortage of reagents? And right now we get reagents from anywhere. We buy them, provided it is the reagents that we have. So, by way of summary, Madam Chair, I just wanted to expound on that because it's an issue that has been in minds of Kenyans and it's been raised. Continuing on and moving on, the other question is, when did the Ministry of Health receive the consignments of donations from the Ministry of Transport? And I would like to clarify that and indeed confirm that it is very close to what was said by my colleague when he was responding, that the ministry received 3 consignments from the government clearing agency, Ministry of Transport, as follows. The Jackma donations on the 24th, first Jackma donation consignments, 24th of March, second Jackma donations, 15th, second one on the same, the second Jackma were received in 2 consignments, the first one on the 15th and the second one on the 28th. And the third Jackma consignment was received on the 24th of May 2020. And then question 4, I'm supposed to give an itemized detail of the consignment. And Madam Chair, the Ministry of Health, through the Ministry of Foreign Affairs, received a note verbal with an attached packing list detailing the contents of the nation as explained in this document that you have, Annex 7. Madam Chair, on the issue of the status of medical supplies, and in particular, the personal protective equipment in the country at the moment. Madam Chair, the provision of PPEs is a continuous exercise in COVID-19. And I would also like to clarify here, Madam Chair, that the PPE is an essential commodity in medical care, not just for COVID-19, but even for other conditions and other infectious diseases that we have. The only issue, of course, is that the speed at which we are using the current PPEs is very, very high. And Madam Chair, I think it is important for us to highlight to everybody, and to the committee in particular, that the biggest problem with these PPEs is that they are essentially not reusable. It's an item that costs 4,300, used once and disposed. And then we have got to get another one. And in fact, Madam Chair, if I may inform the committee, the exercise that is, some of the exercise going on now is to try and see whether we can be able to find ways and means of reusing some of these PPEs. But we cannot do so to risk doctors and nurses. We can only do so once they have proved that, that what I'm asking them is possible. And the demand, Madam Chair, will continue to be high for as long as the current nature of the disease continues. The PPEs in health facilities and communities have been availed by the Ministry of Health through procurement by KEMSA and supplemented by donations, as explained in this document in Annex 8. But there are also other sources, including procurement by county governments themselves, both from KEMSA and direct procurements from other sources, as we agreed, and the President waived the issue of procuring from KEMSA so that they can also buy from locally approved producers. But in addition, the COVID-19 Emergency Response Fund Board has distributed PPE kits to health facilities across the country. Using its capital fund, KEMSA procured also PPE kits, as was presented in their submission to this Committee of Health. I thank you, Madam Chair.
Thank you, CS. I'll give this to the members. We first take the first round, and then we can have the second presentation on the finances. Then we can see Honorable Koros, Honorable Joyce. That's Dr. Eseli, and as you introduce yourself, kindly, as you ask the question, introduce yourself, Professor. Owino, and I'll finish with Tongoyo in that order.
Thank you, Chair. Thank you, Bwana Wasiri.
And Honorable Koros,
Yes, Chair.
you know we are supposed to lead by example, so put... Thank you.
Thank you, Chair. Thank you, Bwana Wasiri. I have just one question, Madam Chair, to Honorable Waziri. Waziri, you said you didn't interfere or you don't interfere with your CEOs under your ministry. But kindly, Waziri, may I know what interest or relationship do you have with everywhere investment or distributors, the company which supplied KEMSA with BBEs?
Honorable Joyce.
Thank you, Chair. Thank you, Chair. While I appreciate the involvement of the CS and coordination of the sagas under him, and the constant regular consultation, I also want to appreciate the urgency that is usually expected in an emergency. Our main concern really was, in the last meeting, was when we were informed that a procurement of 738 million was done by KEMSA through a letter that was sent by the PS indicating the list of items, which was okay, but also the list of prices and the list of suppliers. And when we asked KEMSA whether that was procedural, because we were wondering whether the ministry did the procurement procedures, and I think KEMSA also confirmed to us that it was not procedural. So that is where we are coming from. And our second concern then, the other concern was a very large procurement by KEMSA of over 7 billion, apparently without consultation or maybe even approval, which I think the ministry will tell us whether that was the case, of items that we might even incur losses in price differences, or even warehousing these supplies indefinitely. We were wondering what the ministry is also planning to do with these items. Thank you, Chair.
Thank you, and I'll request Honorable Joyce, you hold on the answer of that question, because the second, the submission be from the ministry, I guess, covers, so you allow them to do their submission, and then I'll give you the first chance to interrogate the answer. Honorable Eseli.
Thank you, Chair. I'm Honorable Dr. Eseli Simiyu, MP for Tongaren. Bwana Waziri, there were some disturbing rumors that the Jack Ma donations were stolen, then sold back to KEMSA. Now, those were very disturbing rumors, especially if we are talking about a donor who has helped the country. I don't know if there was any truth in this, and if you know anything about that. Then lastly, I think, Bwana Waziri, you must be quite disturbed that KEMSA is holding stock worth 6 billion shillings, which was purchased at the height of the pandemic at very high prices, and now they're having difficulties selling them at the current prices, and it will result in a very serious loss to KEMSA.
Thank you. Prof.
Thank you very much, Chair. Thank you very much, Waziri and your team, for coming to present to the committee. I think exoneration is obviously one thing, and so that is acceptable, and that is obviously something that really needs to be done, both in public and in committee gatherings. So listening to Spina's of unconfirmed information, or spiners, as some Kenyans accent use. Listening to spinners of unconfirmed information must be known. We're not here because of the media reports or spinners or any other thing. Parliament is aware, the Parliament is aware that everyone remains innocent until proven guilty, including all your staff and members and all that. So having said that, it is inferred to your guidance and obviously understanding that we want to know what efforts you have done to undertake a clear correction of the issue in place. And obviously, you are here, as you have mentioned, your role is to provide policy, strategic guidance, and leadership to KEMSA and any other institution that comes under you, or any other saga that comes under you. Fair enough, that is quite understandable. But we want to know the efforts you have undertaken to make clear correction on the wrongs that happened. And a declaration of that will obviously be a strength to exonerate anyone who might have been implicated on such matters. Have you had any communication? The second question is, have you had any communication from Jack Ma Foundation since the red flag has been raised, so that we know your competent approach to that matter suffices the responses required to such challenges? Those are my two questions. The previous one was to set the tone. Thank you.
Owino?
Thank you, Chair. First of all, let me thank CS and PS and the team. You have done a tremendous job. What this committee is trying to do is to have a clear statement to put the ministry where they should be and squarely where they should be. But Madam Chair, allow me a second to ask a question directly so that I can proceed with this, because if I don't get it that way, I will be stuck somewhere. So CS, is KEMSA a state corporation? Yes or no? Yes, it is. Is it governed by the State Corporation Act? Yes, it is. Now then, when we're looking at that Act of 2012, you as the CS, Part 4 of that corporation, Cap 446, says that state corporation and control of finances. Every state corporation shall cause to be prepared and shall not later than the end of February every year submit to the minister and treasury for approval, number one, estimate of corporation's revenue and expenditure for the following financial year, accompanied by the proposals and project to be undertaken. That's really squarely falls in your docket. And that brings me to question, if KEMSA, out of their revenue, which we had requested, Chair, that we be given exactly the annual revenue in those 10% and whatever they make on their own, around 4 billion, and they go overboard to buy consignments, 7.2 billion. Doesn't it then occur that those should come to you because they were not in the previous budget? Maybe the Treasury is not aware of it, so that you can have some approval to it. Or is it just a corporation that is determining what they want and do what they want? The other statement, Chair, which is correct, in Section 15 of the same Act, and this is where you are alluding to, as we appreciate leadership, guidance, consultation, I think they were anchored on this. When it comes to accountability, then board shall be responsible for proper management of the affairs of the state corporation and shall be accountable for the money's financial business and management of the state corporation. That squarely fall on the board, and it is in the Act. That's why I acted in the first place. So that is what you are trying to say, that you are not micromanaging. But the other aspect, in fact, the same Act says the CEO can only be called to ask questions, that the board makes a decision. But the annual estimates that comes must be approved. So did you get to know, or some kind of approval, that KEMSA was going to purchase 7.2 billion worth of goods? Lastly, as you know, CS, we are still in the quagmire of this disease. Nobody knows when it will weather off because of its mutation nature. We don't know whether it will mutate up or down, become aggressive and all that. We don't know. So we are still in the fight. But as we are fighting, these members of parliament will tell you, in our constituencies, the healthcare providers are still reusing masks. Some do not even have the masks. Some have the wrong ones. But KEMSA State Corporation is warehousing 6.2 billion worth of merchandise. Whether they are trying to make money of it, I don't know whether that is ethical practice or not. No. Now, you as the person at the helm, what do you direct? What do you guide? Because they were here and they said they need some authorities in order to dispose those. In times of pandemic, you may not care for making profit. And when you will be responding to that, tell us also about the 300 million masks. When you mention Chamber of Commerce, it's foreign to us. When we gave the money, we wanted masks to be given to the impoverished community. Right now, they have not even got it. It says here, this money was not meant for job creation. This money was an emergency. So you can also tell this committee what the Chamber of Commerce is doing in that arena. Thank you, Chair.
Thank you. We can finalize the first round with Honorable Tongoyo.
Thank you, Madam Chair, once again. Gabriel Tongoyo, MP Narok West. I've got just a few questions. One, I want to congratulate the CS for at least for the effort he has tried really, to combat this pandemic. And Bwana CS, when you came into this ministry, it's good to be fair, we saw a man full of commitment and energy. But just before you settled down, you made a personal confession that the ministry that you are heading is full of cartel. It's a mafia house. And you really confess, even before the cameras. We want just to tell us, as you stand now, what is your fair assessment? How do you rate it? Another question, on matters of the PPs, and I think, Madam Chair, I ever said this before this committee. I happened to have been to one of the government facilities, and there was a whole container which purportedly was packed with the PPs. And to our surprise, I was there when it was overloaded. We found a whole container full with napkins. I don't know, they were part of the PPs, but they are full of napkins. It was really very disappointing.
Honorable Tagoe, could you clarify full of what?
Napkins. I don't know, napkins are also part of the PPs.
What, Pampers or?
Pampers.
Okay.
Pampers.
Oh, I had monkeys.
No, Toto. So. Maybe they will tell us whether
I had full of monkeys.
They form part of the PPs. I had asked in the facility, they say yes, but it was not supposed to be those quantities. Maybe they will tell us more on this. Bwana CS, lastly, as the CEO in this ministry,
do you normally make a follow-up of these items, donations, supplies, whether they really reach the designated facilities in this country? So, right? Lastly, I know this is one of a question that you really try to explain when on your opening remarks. I think there was a big allegation from the KEMSA CEO in the Senate saying that you really kind of pushed them to disregard the procurement processes and procedures and award, the tenders against the procedures. And actually, I think he actually made the confession under the oath. So I don't know, you need to come up a little bit clear on this again. Because I'm sure when the pandemic was declared, we had a little bit of some time, and then